Okay, here's another video. This is for Rihanna. Stop. And she, we're gonna do a little more, show you guys some stuff about hand washing, and then taking a patient back, and some other things that we don't necessarily always cover enough. So we have a patient out there in the waiting room. He's already been checked into our EHR system. He's waiting to have his blood drawn, and so Rihanna's put on her mask, and she's going to wash her hands.
Okay.
Oh my god, our sink looks awful. Oh no. So bad. I know you guys are all familiar with washing your hands, but I'm going to just show you again. Just making sure you cover the surfaces of your hand, front, back, between the fingers, fingertips, hands, wrists. No, you're fine. I'm just narrating. I'm not making you do it. I'm being very thorough. A lack of proper hand washing is the #1 reason why communicable diseases, infectious diseases spread from patients to healthcare workers, from patients to other patients because of healthcare workers. It's a known thing. Hand washing is extremely important in initiatives. Rinsing your hands off. Now the way they're taught, of course, is to turn off the sink with a paper towel and wipe around it.
Yeah.
Okay, you know that.
I have to get in there.
Rihanna is a graduate from our school. I hired her. Thanks for. Okay.
And then?
And then she's gonna sanitize. We keep a lot of hand sanitizer, Lysol, things on hand, which is hopefully what you'll get in a medical office if you go work there. She has a patient's chart. I know, look at it. Sorry. This is our office. This is the main office I work at most of the time. So call out the patient's name. Now cover your nose.
Hello.
Cover your nose. Thank you. So he confirmed the patient's name.
Yeah, I did.
We don't we actually called him by his first name in the waiting room. We don't confirm the patient's full name or date of birth in the waiting room because there may be other patients there, and we don't want to violate HIPAA.
Hello, how are you?
Good.
Okay, my name is Rihanna. I'm going to be your medical assistant today. The doctor has ordered me to draw 2 tubes of blood from you. Have you ever had this done before?
Yes.
Okay. Are you allergic to any latex bandage, adhesives, or tapes?
Nope.
Do you pain at the sight of blood or needles?
Nope.
Are you fasting?
Nope.
And are you on any blood thinners?
Nope.
Okay. May I proceed?
Yes.
Okay, so she's assembling her supplies. You can see by her supplies what method she's going to use, right, you guys? Yes.
Oh.
She's going to adjust her tray.
Okay, can you put your arm on this? I'm going to move it. Okay. Are you comfortable?
Yes.
Okay. I think I'm missing something. No.
What are you missing? I think you. Wait, no, sorry, it was behind his arm.
I have a gauze.
Your band-aid.
Okay.
Okay. Remember how we tie the tourniquet? Nice and tight. Nice and tight.
Can you put your arm in a fist? I see it.
She has him squeeze his fist a couple times, and then we see the vein presents itself.
Goes this way.
Right. Yeah. There we go. So you guys should be able to see that right there. A slight discoloration, and it shows where the vein is. Sorry, Martine.
Good doctor.
He gets everything ready. She is right-handed, so everything's on the left of the arm. Do you see that? That way she doesn't have to cross over. That's something you always want to make sure you do. So you don't end up having to cross over. Nice confident stick. We get the blood flowing. This is for an actual lab test, so we're going to have the tubes fully filled with blood. These are serum separator tubes. You'll see they have a yellow gel in them. That gel is thixotropic. Thixotropic means that it's a solid, but when you centrifuge the tube, the force of centrifugation turns the gel into a liquid. It's a liquid that is less dense than blood cells, but more dense than serum. So what happens is after the blood is allowed to clot, then it is centrifuged, and the gel liquefies, settles in between the cells and the serum. Then when the centrifugation stops, it solidifies again, and it seals off all the cells and separates it from the serum, so then the serum can be tested without fear of the cells and serum mixing again and interfering with the ability to test the serum. And it's easier to transport by courier to a lab, because then the tubes can be jostled around and you don't have to worry about mixing. You see how very steady your hand is? It's like a rock, a statue. It doesn't move, it's anchored to the forearm. Very good technique. There we go. Tourniquet, and then tube. And then
Can you apply pressure, please?
mm-hmm.
Thank you.
Very smooth and delicate.
You see you see the tubes don't fill all the way. About 3/4 of the way full there.
And then these ones have to do it.
And if they were not, if they were tubes with additives in them, you'd have to invert them. She doesn't have to invert those. She's just doing that as an example. And then of course we label the tubes.
Yes.
And there are 5 items we label on tubes, which are the patient's first and last name,
Date of birth.
date of birth,
The time of collection.
time of collection, also
And the date.
date of collection, and our initials.
My initials.
Her initials. Okay. Thank you, Rihanna, once again. Very good job.
Welcome.